Yes, hello everyone. This is Dr. Kampala, a qualified medical doctor here in Uganda, and welcome to this platform. On this platform, we shall be sharing medical content. Make sure you follow the platform such that you can be updated in the times when we post programs like this. So in this case, we are going to discuss about hernias. A hernia is a protrusion of abdominal content through the weak points. You understand? Secondly, they are classified in three classes. Number one, we have incarcerated hernias, we have strangulated and reducible. For instance, if I can start with strangulated hernias. In strangulation, here, for example, if the abdominal content is protruding through the weak areas or the weak points of the abdominal wall, it gets stuck. While it is getting stuck, we have blood supply cut off. Usually, the other point which is trapped will not be supplied with blood. Therefore, it is managed as an emergency, and that is what we call strangulated hernias. Secondly, we have what we call incarcerated. In incarcerated hernias, here, after the abdominal content getting trapped in the weak point or weak areas, blood supply is still intact. Here, our viscera is still receiving blood supply, nutrients, oxygen. Reducible hernias. Reducible hernias, these are different compared to the two I have described above. In reducible hernias, for example, there is a swelling, of course, but this swelling usually reduces from the word reducing. For example, a patient or somebody may present with a swelling, but this swelling, when the intra-abdominal pressures reduce or in a flat position, the swelling disappears. That is what we call reducible hernias. But however, not forgetting, we also have types. They are different types. For example, we have an inguinal hernia. This is common in males. Usually, when in stages of development, we have the tecists descending from the abdominal cavity downwards into the scrotum. As they are descending, there leaves something like a tube, or what I can, in simple terms, what I can describe as a pipe. As it is descending, we have a lot of instruments which are moving along with the test descending. Therefore, this is what we call an inguinal canal. So in this canal, whenever there is any disturbance, for example, or intra-abdominal pressures increasing, we can have intestinal contents or abdominal contents protruding and moving all the way throughout from the abdomen up to down the scrotum, and that is what we call an indirect hernia. We also have others. It is also part of an inguinal but indirect hernia which go through the deep ring. Then we also have a direct one. This may go through the weak areas, for example, the fascia. Make sure you follow the platform such that you can be updated in the times when we post programs like